Welcome to Retreat U Podcast. Today we're doing a deep dive, really getting into something crucial.
Absolutely. We're focusing on gum health today, drawing from some really practical insights, straight from a practicing dental hygienist. And there's a surprisingly positive message here.
Yeah, it's almost like a public service announcement, isn't it?
Yeah.
The core message is just so direct, you still have time to save your gums.
And that hits home, I think, because so many people just assume, bleeding gums, a bit of recession, just part of getting older, or it's unavoidable.
Exactly, that feeling of, oh, well, nothing I can do.
Yeah.
That's the biggest mental hurdle we need to jump over today.
Right. So our mission really is to break down 4 key actionable steps. Pillars, you could call them, things you can actually do to start bleeding, halt that recession, and genuinely improve your gum health.
Okay, let's start by tackling those mental roadblocks, those myths that let people sort of accept bad gum health. The source material jumps right on 2 big ones.
The first one, every dental professional hears this constantly. Yeah, my gums bleed when I floss. Always have. It's normal for me.
Right, just sensitive gums.
And the hygienist we're drawing from is just emphatic. No, your gums should absolutely not bleed. Bleeding isn't sensitivity, it's inflammation. Plain and simple.
Yeah.
Almost always linked to, an infection gingivitis.
Okay, stop right there.
Okay.
That's huge. We need to reframe bleeding, not as an annoyance, but as a literal symptom. What's actually happening, like biologically, when gums bleed?
It's your immune system fighting back.
Yeah.
See, when plaque, which is just loaded with bacteria, builds up right at the gum line in that little pocket called the sulcus, your body sends in the troops. It mounts an attack. But the constant presence of these bacteria triggers this low-grade chronic inflammation. The tissue gets puffy and gorged with blood cells trying to deal with the invaders. That's edema.
Okay. Swelling.
Exactly. And the tiny blood vessels right near the surface become really fragile, kind of leaky.
Yeah.
So when you introduce any mechanical force like floss or even a toothbrush bristle, they rupture. That's the blood you see. So accepting bleeding is basically accepting a constant low-level infection simmering away in your mouth.
Wow. Okay, that completely changes the perspective. It's not cosmetic.
Right.
It's a health issue, fundamentally. Now, the second myth, this one's about receding gums, right? People think it's just weak gums they inherited.
Yeah, that's a super common assumption. Oh, my mom had bad gums, so I do too. But the source material flips that completely. In most cases, it's not that weak gums cause the recession.
So it's the other way around.
Precisely. It's the process, whether it's brushing too hard or that bacterial irritation we just talked about that causes the gums to pull away. The recession happens first, and that makes the area seem weaker over time. It's a result, not usually a pre-programmed fate.
I really like that distinction, because if it's caused by things you can control, like plaque or bad habits, you actually have the power to stop those causes. It's not inevitable.
Exactly. It removes that sense of fatalism. And the clinical evidence backs this up. You can stabilize recession, stop the bleeding, see real improvement. You're not just stuck with it.
Okay, that's empowering. So let's get into the action. Pillar 1. This seems foundational. The electric toothbrush mandate.
Yeah, mandate is a strong word, but the source argues it's a necessary clinical upgrade, especially if you already have issues like bleeding or recession.
Why, though? I mean, lots of people use manual brushes. Can't you just learn to be careful? Is it really that different?
Well, you can use a manual brush effectively, theoretically, but the source hygienist observes that most people, particularly those already struggling with gum problems, just don't. It's really hard to consistently get the pressure right, the angle right, for the full 2 minutes.
Okay, so what does the electric brush solve? Is it just speed?
It's not just speed, it's consistency of motion. That oscillation or sonic vibration is hard to mimic manually. But the absolute game changer, the thing that makes it a clinical tool and not just a gadget, is the pressure sensor.
Okay. Let's focus on that. Because the source says incorrect pressure is a huge problem, right? It's this weird balance, gentle enough not to damage, but firm enough to remove plaque. How does the sensor help with that?
It's critical because bad pressure causes 2 problems at once. Press too hard. You're literally scraping and pushing the gum tissue down, making recession worse, physically abrading it.
Right, direct damage.
But there's more. That excessive force over time puts mechanical stress on the tooth itself, right at the gum line. It causes these little notches, sometimes V-shaped, called abfractions, and that stress actually weakens the connection between the tooth and the gum.
Wait, so brushing too hard doesn't just hurt the gums, it damages the tooth structure where the gum is supposed to attach.
Exactly. The tooth itself flexes microscopically under that pressure. The pressure sensor is designed specifically to stop this. It alerts you light, sound, vibration change the instant you push too hard.
So it's like a real-time coach.
Precisely. It forces you to ease up immediately until the alert stops. Over time, it literally retrains your muscle memory. You learn what just right feels like.
No, that makes sense. So the takeaway is crystal clear. If you're serious about improving gum health, get an electric toothbrush and make sure it has that pressure sensor. It's not optional.
It's the feature that protects you from yourself, essentially. And it's often the first step where patients see quick, visible results. Puffy, red gums start looking firmer, healthier, sometimes within weeks.
Okay, that's pillar one, getting the brushing right with the right tool. That leads logically to pillar two, right? Cleaning between the teeth.
Yes, the two-part interdental cleaning strategy, because even the best electric toothbrush can't really get into those tight spaces effectively.
And the goal here, the source says, isn't just floss like you're supposed to. It's broader.
Yeah.
Clean between your teeth.
Right. String floss is still important. We'll get to why. But the hygienist introduces a powerful partner, the water flosser, sometimes called a water pick.
Ah, yes. People often ask, can I just use the water flosser instead of string floss? I hate string flossing.
Common question. The source suggests the water flosser is incredibly good, maybe even better for the gums specifically, especially if bleeding and inflammation are your main problems. But it doesn't completely replace string floss.
Okay, so it's not either, it's a power combo. Why both? What does each one do that the other doesn't?
They tackle slightly different things. String floss is still the best tool for physically scraping the sides of the teeth, the mesial and distal surfaces. That scraping action is key for dislodging stuck-on debris and, really importantly, preventing cavities between the teeth.
Interproximal cavities. Got it. So the string floss is like scraping the walls clean. What does the water flosser do better?
The water flosser excels at disrupting the bacterial structure, especially deep down in that gum pocket, the sulcus. It gets into places the string might miss or can't flush out effectively.
Let's get nerdy for a second. Bacterial structure, you mean the plaque, the biofilm?
Exactly. Biofilm isn't just loose germs. It's a whole organized community stuck together in this slimy, protective shield. They make themselves the EPS, extracellular polymeric substance. It's usually a clear, sticky,
And hard to get rid of.
very. String floss breaks it up physically. But the water flosser uses a focused, pulsating stream of water. It creates this thing called hydrostatic shock.
Hydrostatic shock. Sounds intense.
It basically forces water and pressure into that tight space, disrupting the biofilm structure and, crucially, flushing out the bacteria and the nasty byproducts they create from deep within the pocket. For anyone with bleeding gums, flushing that deep sulcus is huge. It dramatically lowers the bacterial load.
Okay, so if string floss is the scraper getting the big stuff off the walls, the water flosser is like a high-pressure hose blasting out the gunk hiding in the cracks and under the baseboards.
That's a great way to put it. And the source stresses you're removing tons of this invisible gunk, the clear biofilm. Even if you don't see any food particles come out, you're washing away the cause of the inflammation.
And when you remove that constant irritation, the source makes a pretty bold claim. People see wonderful results in just 10 days of using this combo daily.
It sounds fast, but it makes sense if you think about gingivitis, the inflammation part. That can resolve quickly once the bacterial trigger is gone. Which brings us back to that idea of gums growing back.
Yeah, let's clarify that. Because actual lost gum tissue, true recession exposing the root, doesn't just magically reappear without surgery, right? So what is happening?
It's about reversing that swelling, the edema. Remember how inflamed gums are puffy, red, maybe slightly pulled away because they're so swollen? When you remove the bacteria with the power combo, the inflammation goes down, the swelling disappears. The tissue naturally shrinks back down to its healthy, tight shape against the tooth.
So it looks like it grew back because the unhealthy puffiness is gone, and it's now tight and firm and pink again.
Exactly. It finds its happy place, tight against the tooth, because the irritant pushing it away is removed. And that tight seal is what protects the underlying bone. So pillars 1 and 2, the electric brush and the combo cleaning, that's your daily defense against the soft plaque.
But we're not always perfect. Some days we rush, some spots get missed, and that leads straight into pillar 3, doesn't it? The professional side of things.
Absolutely. Routine professional intervention. Because no matter how good your home care is, you simply cannot remove hardened buildup yourself.
Okay, let's define terms. We've talked about plaque, the soft, sticky bacteria film. What's the hard stuff?
That's tartar, or the technical term is dental calculus. If plaque sits undisturbed on your tooth for, honestly, as little as 24 to 72 hours.
That fast?
Yeah, the minerals in your saliva calcium phosphate start sticking to it, embedding into that biofilm matrix. It literally mineralizes, hardens. The source calls it like a rock stuck on your teeth, and that's pretty accurate.
So the whole point of brushing and flossing daily is to get the plaque off before it turns into that rock.
That's the goal, preventative maintenance. But let's be real, like the source says, none of us are perfect robots. We all miss spots. Behind the lower front teeth is a classic area, the backs of the molars. Inevitably, some tartar forms.
And once that tartar is there, especially below the gum line, it's just a constant irritant,
Yeah.
right? And a rough surface for more plaque to stick to, a vicious cycle.
Totally. And here's the key limitation of home care. You cannot brush or floss tartar off. It's chemically bonded to the tooth. Your toothbrush bristles, the water stream, they just glide over it.
So you need special tools.
Yep. You need professional instrument scalers, ultrasonic devices wielded by a trained hygienist or dentist. They have the tools and the skill to physically, carefully break that bond and remove the calculus without damaging your teeth.
So pillar 3 isn't optional if you want to maintain progress. Routine professional cleanings are the only way to get rid of tartar. How often are we talking?
Well, the standard is usually every 6 months. But the source implies that if you're actively battling gum issues, you might need more frequent cleanings initially, maybe every 3 or 4 months, just to really get things under control and reset that bacterial load. Skipping this just undermines all your daily effort eventually.
Okay, so right tools, pillar 1, right? Daily habits, pillar 2. Essential professional backup, pillar 3. That seems like a solid plan for tackling bacteria and inflammation. But there's a fourth pillar. Something about mechanical damage.
Yes, and this one's often overlooked because it can be subconscious. Pillar 4, protecting against clenching and grinding, or bruxism.
Teeth grinding.
Yeah, the source highlights that loads of people do it, mostly at night while sleeping, and they have no idea. The forces involved are huge.
And the damage isn't just wearing down the teeth, right? There are two kinds of harm.
Exactly. First, there's the obvious stuff, chipped edges, flattened chewing surfaces. Dentists spot those where facets easily. But the damage relevant to our gum discussion is the chronic stress it puts on the entire tooth and its support system.
How does grinding your teeth make your gums recede? What's the connection?
When you clench or grind, you're putting massive sideways and clamping forces on the teeth. They're not designed for that kind of sustained pressure outside of normal chewing. This force makes the tooth flex, just slightly, within its socket in the bone.
The tooth itself moves a tiny bit.
A microscopic amount, but repeatedly, sometimes thousands of times a night. This constant forceful flexing puts immense strain on and can actually shear the tiny fibers that connect the gum tissue and the bone to the root of the tooth.
Whoa, so it's not just surface rubbing, it's like loosening the tooth's anchor points for the gum due to that micromovement.
You got it. And this stress often shows up visibly as those abfraction notches we mentioned earlier, right at the gum line. It weakens the whole attachment complex, leading to gum recession driven purely by mechanical stress, even if your plaque control is perfect.
Okay, that's a hidden threat. So until you figure out why you're grinding, stress, sleep apnea, whatever, what's the solution?
Passive protection. The simple act of wearing a night guard while you sleep can absorb or redirect those forces. But, and this is really crucial, the source gives a very specific warning about what kind of night guard.
Right. Not all guards are the same. It's not like a sports mouth guard.
Definitely not. A sports guard is soft, designed to absorb impact. A night guard for bruxism needs to manage pressure and prevent flexing, and the material is key.
What's the warning?
It must be hard acrylic plastic, not soft plastic. This is a super common mistake people make. They buy those soft boil and bite guards.
Because they seem more comfortable.
Exactly. But that soft, rubbery material can actually act like a chew toy. It gives your jaw muscles something yielding to bite into, which can inadvertently encourage or even worsen the clenching habit.
Huh. Never thought of it that way. But isn't a hard plastic guard really uncomfortable? Might it cause jaw pain itself?
It can take some getting used to, definitely. There's an adjustment period. But the hard acrylic provides a stable, slippery surface. When you try to clench or grind, your teeth slide easily, the pressure gets distributed more evenly, and it discourages the intense muscle engagement. Most importantly, it prevents that damaging tooth flex.
So, a bit of initial discomfort with the hard guard is way better than letting a soft one potentially make the grinding worse and allowing that damaging flex to continue.
That's the clinical rationale, yes. And you have options. A custom one from the dentist is ideal, fits perfectly. But there are also good over-the-counter hard plastic ones, often the boil and bite type, available in pharmacies. The key is getting a hard plastic guard and using it.
Okay, that wraps up the 4 pillars. It's quite a comprehensive approach, tackling bacteria, plaque, tartar, and this hidden mechanical damage.
It really is a unified strategy. So let's quickly pull it all together for you, connect it back to a daily routine.
Right. Pillar 1, electric toothbrush with that pressure sensor. Brush at least twice a day, focusing on technique.
Pillar 2, the power combo string floss and a water flosser. At least once a day. Get that biofilm out from between the teeth.
Pillar 3, don't skip those professional cleanings. That's the only way to remove the hardened tartar. Schedule them regularly.
And pillar 4, if you suspect you might grind or clench, or if your dentist sees signs, get a hard plastic night guard and wear it.
The whole point of this routine, really, is taking control. Remove that soft plaque daily so it doesn't irritate your gums, cause bleeding, or get a chance to harden to tartar and accelerate recession. It puts you back in the driver's seat.
And speaking of taking control and supporting your body's response to all this.
Oh yeah, so if you're like me and you want to try this for yourself, I've got a deal for you. The team at Prodentim has set up a page just for our listeners that automatically applies a discount. Plus, when you order there, you get some fantastic bonus packages, absolutely free. It's the best value you'll find. Just check the description below, check it out, and see the special bundle they've put together for us.
Right, that's definitely something to consider as part of taking action. So let's finish with a final thought, maybe a little provocative question for you listening. Why does this matter right now?
Well, the source material is pretty blunt about this. If you don't currently have a dental checkup or a cleaning appointment booked,
Yeah.
this is your sign. Make one right now.
Exactly. Because while we've laid out the principles, the 4 pillars, your dentist or hygienist can personalize this advice. They can actually measure your gum pockets, see exactly where tartar is building up, spot those telltale signs of grinding.
They know your mouth.
Yeah.
They can tailor the plan.
Precisely. It's where the general knowledge we share today meets your specific situation. So get that baseline assessment, start implementing these pillars, and really take ownership of your oral health. You can make a difference.
Couldn't agree more. Get informed and get proactive.
Until next time on our deep dive, keep brushing, keep flossing the right way, and trust that improvement is possible.